At the International Meeting on Emerging Diseases and Surveillance, Dr. Timothy Brewer discussed factors that expedite outbreak recognition.
When people get sick, they go to their primary care doctors. They don't know necessarily that they might have a new disease. They just know that they're sick. And so the astute family physician just needs to be on the lookout for something unusual. And if you see something that doesn't make sense, like severe respiratory disease in an otherwise young, healthy person, that should raise a warning flag that, hey, maybe I should call the public health agency and just let them know I'm seeing something that doesn't fit the normal pattern. So there's a lot of work looking at both informal information and looking at automatizing surveillance data. So let's take the first. On the first, what we have is we have millions of people on cell phones, we have people tweeting, we have people doing searches on the internet. And what public health agencies and researchers are trying to understand is, can we collect those data and somehow use them to inform the recognition of new diseases and outbreaks? For example, Google flu. So Google has set up a system whereby people do Google searches on influenza, flu-like symptoms, and you can actually track how influenza spreads across the United States by people doing Google searches. As the virus spreads and people get sick, they start doing more searches. And so that's one area, trying to capture those electronic data to see if we can recognize outbreaks sooner. On the other side, with the medical records and with the laboratory system, what electronically making those records is doing is it's making it much easier to transmit information and compile it. So what we're seeing, and this is including some research that colleagues of mine have done with me, is we've seen trends in shorter times between when outbreaks start and when they're recognized and reported. And I think having those electronic systems are critical to that advance. What's going to trigger an alarm bell first is somebody saying, this doesn't seem right to me. This pattern doesn't make sense. The disease is too severe, it's in the wrong group, and that is actually the best way to detect outbreaks, is somebody recognizing this is out of the ordinary and then turning to a public health agency or someone else and saying, hey, this doesn't make sense to me, can you help me out? And electronic medical records will never replace that.